My name is Mark Parkinson. I am the CEO of the American Healthcare Association and National Center for Assisted Living. We represent 10,500 skilled nursing facilities across the country, as well as 4,000 additional assisted living facilities across the country. We really appreciate the opportunity to provide input today. I had a chance to read the draft report this morning, and I was extremely impressed. I mean, it is really great to see such thoughtful work product. Super impressed with the work that you've done, and glad to try to give you some input to help shape it in any way that we can. I think, it's very clear that the impact on older people, and in particular older people that live in congregate settings, has just been absolutely devastating. We have very good data on skilled nursing facilities because we are required to report every week. And so we now know that almost 200,000 people living in skilled nursing facilities have contracted COVID. That's an astonishing number when you stop and think that there are only about 1.5 million people in these facilities at any given time. 200,000 have contracted COVID. Even worse, of course, is that we know that the mortality rate for people that is over 80 years old is really high. And the average person that lives in one of our facilities is 83. The mortality rate is somewhere around 20%, perhaps even a little bit higher than that. We now know that definitively through the reporting that we have almost 50,000 deaths in skilled nursing facilities. We don't have good data on assisted living buildings and independent living buildings because there's no required reporting requirement, but it's very clear that there have been tens of thousands of deaths in those settings as well. And so for that reason, it's obvious, and I don't think debatable, that any sort of prioritization of a vaccine really needs to try to figure out how to address this population. I think that the framework that was put together in the draft is brilliant. The idea of maximizing the benefits of what might be a limited supply of vaccines makes complete sense. And any sort of analysis of how you maximize the benefits would certainly include older people in congregate settings as well as the people that take care of them. And that's been a tragedy as well. We've lost almost 1,000 caregivers to COVID, and so they certainly need protection as well. We only have a couple of substantive comments. The first would be to completely endorse the comments of Brendan Flynn that he just gave from Leading Age, which is that it's not just skilled nursing facilities where these people live, it's also independent living facilities, assisted living facilities, and a number of other settings that older people are living together, and we need to make sure that we protect them all. And secondly, you may need to do some analysis based upon the effectiveness of the vaccine. If the vaccine is approved but not completely effective, maybe only effective at a 50 or 60 or 70% level, we may need to give some serious consideration to what do we do about healthcare workers and their immediate families that they go home and live with. What do we do about caregivers that come into facilities that might not otherwise be in a protected age group? So for example, we have a lot of family caregivers that are women, 50, 60 years old, that are taking care of their parents, some men, but it tends to be women. And we might, again, if the vaccine is not effective, they might not fall into a top tier category, but we may need to give some consideration there. So finally, just let me conclude by saying that your work product is truly impressive. We will be submitting some additional written comments and really appreciate the opportunity to be heard.